So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after, let's discuss this test step by step. So it's 52-year-old man. He has deep vein thrombosis, and the first line treatment of deep vein thrombosis is IV heparin. So unfractionated heparin was infused. And we know that heparin is anticoagulant, and the heparin effect we monitor by prolongation of partial thromboplastin time. However, in this case, 48 hours after heparin infusion, PTT remains the same, which is totally uncommon for heparin. And all other values in his blood analysis are normal, which is fine. So the question here is what disrupts heparin effect? To solve this test, we have to recall hemostasis. Recall that secondary hemostasis consists of intrinsic and extrinsic pathways. Intrinsic pathway has a lot of coagulation factors. Extrinsic pathway has just factor 7. Both intrinsic and extrinsic pathways activate factor 10. Activation of factor 10 leads to activation of factors 5, 2, and 1. Activated factor 2 called thrombin, and thrombin converts fibrinogen into fibrin, which is factor 1, and fibrin with platelets form thrombus. Our coagulation cascade is controlled by several factors. Among them is antithrombin. The function of antithrombin is to control coagulation by inhibition of factor 10 and factor 2, which is thrombin, hence the name antithrombin. And we have drug called heparin which acts on antithrombin. Heparin stimulates antithrombin activity, which leads to inhibition of coagulation and thereby to inhibition of thrombus formation. We monitor heparin effect by prolongation of partial thromboplastin time, which is a marker of intrinsic pathway. So the major point is that heparin needs antithrombin. Because heparin cannot inhibit coagulation directly, it requires this intermediate molecule. And the only reason why heparin can be totally inefficient is antithrombin deficiency, where we do not have this intermediate molecule to act on coagulation. So with antithrombin deficiency, partial thromboplastin time will remain normal, and thrombus formation will occur at the previous rate. So with antithrombin deficiency, heparin has no effect. So the correct answer here is antithrombin deficiency. Vitamin K deficiency causes prolongation of prothrombin time, which is a marker of extrinsic pathway together with international normalized ratio. Warfarin-induced skin necrosis is absurd, because we do not have warfarin exposure and we do not have skin necrosis, and warfarin causes prolongation of prothrombin time and international normalized ratio, so it's definitely not it. Heparin-induced thrombocytopenia can occur with unfractionated heparin, but it causes thrombocytopenia, and in this case, platelets are normal. Factor V Leiden mutation is the most common thrombophilia, but this condition is not related to heparin.